Hi, my name's Rosie Alistair. I wanted to talk about an area of veterinary practice that's really important to me. I have an interest in social aspects of veterinary medicine, and from my own time in practice, one area I found to be really important was supporting clients who may have some type of vulnerability. So what I wanted to focus on particularly in this session was veterinary consulting with clients with mental health needs, learning disability, acquired cognitive impairment, and also neurodiverse clients. So for this session, I'd like to talk about what's our role as veterinary nurses and as vets. I'm going to think about animals and human vulnerability and some of the ways that animals can support people who may be vulnerable in different ways. Think about animals and health, particularly about mental health. I'm thinking about what society expects from vets and what our clients expect. What's expected of us in our code of professional conduct with the Royal College of Veterinary Surgeons. Some principles for decision-making capacity. So the Royal College Code talks about how it's important that we're aware of mental incapacity and how that may affect veterinary situations. So I'm going to actually talk about how you would assess capacity and what that means in a veterinary context. Some principles for consulting, some adjustments for people who may be experiencing different types of vulnerability, and also for autistic clients. And then some example cases, some small case studies that are fictional, but are similar to cases that I've come across in my career. I'd also like to thank my collaborator on this material, Dr. Alex Thompson, who's a consultant liaison psychiatrist and helped particularly with the parts of the material about decision-making capacity. So what is our role and what do we need to consider when working with clients with vulnerability? I think this goes to a core question of what it is to be a vet or a veterinary nurse. And the traditional frameworks we have may only provide partial answers. And I'll go on to talk a bit about what we mean by that. There are important human, professional, and considerations in law that we need to be aware of. So people have been living alongside animals for the whole of human history, and I think as professionals working alongside people who may be vulnerable, we also need to be aware of where societal stigma and discrimination may influence our assumptions and decisions without us maybe having a current awareness of it. It's something we need to be vigilant about in our own practice. There are a few cases where mental health conditions directly negatively impact animal welfare. They're rare, but they can occur, and a specific example of this would be animal hoarding. It's important to get specialist advice in those cases. It's also important to remember that most people with vulnerability care for their animals and want the best for them, and that's an important principle for us to be aware of. We know that our role as veterinary professionals is to be the voice for the animal, but we also need to balance that with the client's preferences and their wishes, and we'll talk more later about how to do that. So animals have a lot of benefits for people with vulnerability, and I've just summarised a few of the key papers from the literature here. There's a great paper by Brooks and colleagues looking at direct and indirect benefits for mental health from companion animals. Animals can also reduce anxiety and lower stress for people with learning disability. They can help people with behavioural and psychological symptoms of dementia, and that can sometimes be as therapy animals as well. For autistic people, animals can have many roles in their lives, both as social supports and companion animals, and I'd really recommend Temple Grandin's amazing writing on this. So just looking in a little more detail at the Brooks paper, some of the ways that animals can assist with the work of managing mental health problems. They can be a proximal source of calm and companionship, and I'm sure this is something that we've all seen or even indeed experienced in our own lives. They have a depth of connection that can be particularly helpful and protective when people are in crisis. They accept without judgment. They offer behavioural activation and routine. They can help to motivate people to continue with activities of daily life that they may be struggling with because of their health. They can facilitate the quality and quantity of social interactions as well, which I'm sure is something that a lot of us have experience of too. However, there can be negative aspects of pet ownership for mental health, and it's important as veterinary professionals who may be called on to advise in some situations that we're aware of this, and we're aware that for our vulnerable clients, when their animals are experiencing behavioural problems particularly, or when they are experiencing animal bereavement, they may be particularly vulnerable. It may be affecting their health, so it's important that we're aware of those issues too. For clients with housing related vulnerability, there can also be difficulties in accessing housing because of pet ownership and financial cost, particularly in the private rental sector, of trying to find places that will accept animals. And I think it's important as veterinary surgeons and veterinary nurses we consider what our role can be in advocacy there. So why is this area important for vets? Why does social aspects of veterinary medicine that I'm interested in matter? I think it's important partly because it's something that society expects of us and our clients expect of us, and our clients need us to be able to help with. So a couple of different studies I've picked out here demonstrate that farmers look to vets for mental health support. So farmers are more likely to turn to vets for mental health support than other rural service providers. A study that was looking at the foot and mouth epidemic found that farmers went to friends and family and vets before any other health or social care professional. It's also the case with companion animals. Clients look to vets for psychological support following pet bereavement. And a recent study also found that this can have a psychological impact on vets. And I know that this is something many of us will have experienced during our career. This is partly potentially because we're expected to provide a lot of psychological support, but we don't have the traditional support structures in our profession that people who are providing a lot of psychological support might expect. And this is something we need to consider as a profession and as practices about how we might offer that support and support our staff, because this is something that clients, society expect of us, need from us, and we can do to the best of our ability when we're well supported ourselves. It's also expected of us in our Code of Professional Conduct from the Royal College of Veterinary Surgeons, and I've just picked out a few areas from the code that are particularly relevant to this area. 2.1, veterinary surgeons must be open and honest with clients and respect their needs and requirements. Also part 11, communication and consent, says we should treat clients fairly and without discrimination. Parts 11.31 and 11.32 specifically relate to incapacity, and I've included the link to this area on the slide here. So this is the part of the code that talks about mental incapacity. I'll let you read it for yourselves. The important parts here are that it talks about what we should do when it appears a client lacks the mental capacity to consent. It doesn't talk in detail how we might assess mental capacity to consent, and so that's what I'm going to focus on. We need to be able to do this, and so we need to know how to assess it. So when we're thinking about mental incapacity, it's important that we remember that mental incapacity, even if people lack capacity to make a specific decision, that doesn't exempt us from consulting clients to still try and determine their views and wishes, nor from us respecting those views and wishes if they are compatible with the animal's best interests. So even in the absence of capacity, it's important that we still consult and we still weigh up what those preferences are alongside what we consider to be the best interests of the animal. So what are some principles of decision-making capacity? And thanks again to my collaborator, Dr. Alex Thompson, for assistance with this section. The definition of decision-making capacity is that somebody can understand information, what's proposed, the risks, the benefits, and the alternatives. They can retain that information long enough to make a decision. They can use and weigh that information, and they can communicate that decision to others. So what does this mean for us? In practice? It's important that we don't presume incapacity just because someone has a particular condition. We should make every effort to optimise capacity, and we're going to talk in a moment more about how we can do that. We also need to remember that capacity is specific to each decision. You can't just say that person doesn't have capacity. Capacity relates to particular decisions. So in our case, those will usually be decisions about veterinary treatment for their animals. Any decision must take into account the person's past and present views and wishes. So there's some pitfalls about decision-making capacity, areas where we could go wrong. Just because somebody makes a decision we wouldn't, or a decision that doesn't seem wise, that doesn't mean they don't have capacity. But it's important that if that's happening, we do negotiate and discuss. It's also important that we don't presume our gold standard clinical recommendation accords with people's views and wishes. It's important we retain the ability to be pragmatic and to compromise, as we do in so many areas of our work. It's also important that we don't conflate somebody's ability to do something with the ability to make decisions about it. So just because somebody can bring a dog in for surgery and can be present in a consultation doesn't mean that they actually necessarily have capacity to make a decision about consenting for surgery. So when we are assessing capacity, we actually need to be very clear ourselves about the risks and benefits of that treatment for that animal. And if we aren't clear ourselves, there is no way we can assess the person's capacity. So this is a challenge for us clinically as well. When you're trying to determine capacity, you must explain 3 things. You have to give the client options, and there should be 3 of those options. What's the recommended treatment? What's the alternative? Do nothing, conservative management. And what's the compromise option? Sometimes challenging to find a compromise option, but there almost always is one. We then should explain the risks and benefits of each of those 3 options. And the key part is we should explain the risks and benefits of each of those 3 in a way that the client can understand. Until we've done that, we can't assess the person's capacity. It's important that we give them that information to give them the chance to make that decision. We should make our information as specific as possible to the person's circumstances, their needs and their wishes, and that may involve some of the adjustments that we're going to be speaking about later. So those 3 things that we should be able to explain, and we should also know the risks and benefits for, are the recommended treatment, the alternative, do nothing or conservative management, and a compromise option. So how can we adjust and support? Written information, pictures, diagrams can help. Allowing people time, minimising stress when someone's waiting in a consultation, minimising loud noises, beeping machines, those kinds of things. All of those things can increase stress and make it more difficult for people to retain and process information. Communication support might be an interpreter, might be sign language. Involving carers or friends who may be able to assist communication with an individual with their consent. If it's not an emergency, sometimes the best way to determine capacity or to assist with capacity is to allow some time, especially if the person appears to be acutely unwell or intoxicated and you have a belief that they may recover some level of capacity at a different time. So in determining what the best interests are in a situation, we always consider the context of animal welfare. We are the voice for animals in these situations, as we are daily in our roles. However, it's also important that we determine what preferences the client has, what they would have wanted before they've lost capacity, if they don't seem to have capacity to make a particular decision. In some circumstances, we can consult attorneys, deputies or guardians if those are in place. We can also consult relatives or friends who can't make the decisions for the person, but they can describe the client's views. So most people care about their animals and want what's best for them. Capacity assessment involves a lot of really good communication by us. It involves us being clear about the risks and benefits for those 3 options, the do nothing, the treatment that we recommend, and the compromise option. And it also involves taking time, consulting others, sometimes seeking advice, and being prepared to compromise where we can, while still being the voice for the animal. So I said I was going to speak about some adjustments that you could potentially make for groups of clients in practice. And the first group of clients I wanted to talk about were autistic people. Autistic people process information differently, which may impact the way individuals relate to others, including to animals. It's important that we're aware of the environments and the veterinary spaces we expect our clients to be able to meet with us in. Noisy or crowded environments can affect how much information people can process, and this is a really important thing to consider. Lighting can also be a significant issue, and where possible, low lighting or no fluorescent lighting. I know that's hard in a lot of veterinary spaces, but if there are fluorescent lights, try not to switch them all on in the consult room that you're using. And try to consider the time of the appointment that you give somebody, how long they're going to have to wait in a noisy space, whether you can create a quiet waiting space for people. Change is also important. Changes to time, venue, date of appointments or procedures can be difficult. Where you can, give as much warning as possible. Keep to a regular venue, time and date if you can. Regular appointments can be really useful here at a specific time of day that suits the person. When we're late, and I know that can sometimes be a feature of veterinary practice when we're dealing with emergencies, it can cause significant anxiety for autistic people. One way you might want to adjust to this, if it suits the person, is consider using a first appointment in a clinic so that they have a chance for a quieter waiting room and also a lower chance of lateness. Allowing extra time can help. Some people take longer to process information and they may need longer to respond. Could also provide accessible written information. Think about flexibility in methods of contact. Think about whether email or SMS contact for a practice is possible. Avoid irony, reading between the lines, sarcasm, rhetorical language, exaggeration and gestures. Also avoid open-ended questions. Try not to use too many. Use options or choices, but be specific, and just a couple of options at a time, one issue at a time. For clients with acquired cognitive impairment, and this may include dementia, brain injury, consider flexibility in appointment reminders. Just because we usually only send a text message, for example, if somebody would actually benefit from a phone call the day before to remind them, and consider doing that. Written reminders, cards, email, whatever it is that suits that person. Also be aware that appointment length and the time of day need to be within the individual's ability to cope and their preferred timings. People may have times of day where they're more able to remember things or process information. Long appointments may be particularly difficult, so shorter appointments may be more helpful. Every time you meet with somebody, regardless of how many times you've met before, introduce yourself with your name and your role. Minimize stress. Be really mindful of background noise. Crowded spaces can make it much more difficult for people to remember when they're stressed. Listen, validate and reassure. Try not to interrupt. Give choices, but again, don't overwhelm, one issue at a time. Written materials can be really important too. A written record of appointments and written treatment plans that are dated. Another group of clients that I wanted to speak about are clients who are experiencing unusual behaviour, including beliefs that may be delusional. So a delusional belief would be a false belief. An example of a client in this situation might be a client who the pet is completely normal on clinical exam. However, the client has a very strong belief that they can see insects burrowing out through the animal's skin, and they keep telling you about these insects. They're very concerned about them. They show you pictures that they believe to show the insects and you can't see anything. It's important to remember in cases like this that the person believes what they're thinking and saying, often very strongly. You're unlikely to be able to talk them out of it. They also may not be able to follow arguments, so presenting what we may see as compelling evidence is likely to make not much difference, other than potentially cause frustration. You can still explain evidence, but be prepared for it not to be believed. It's also important not to argue or get drawn into conflict on the issue. It won't help and it may escalate things. You can imagine what this might feel like for a client if you believed something incredibly strongly, perhaps more strongly than anything else that you knew at that time, and somebody just wanted to argue with you about it and tell you it wasn't true. That's not going to be a good experience for you. It's not going to be a good experience for our clients in this situation either. This doesn't, however, mean you have to agree with a delusional belief, and indeed it's important that we don't. But you don't have to directly disagree with it either. So don't directly challenge delusional beliefs. It tends to make them stronger. Instead, use an approach that's empathetic, kind. If you need to explore evidence, do. Offer reassurance. Don't be offended if the client doesn't believe you. Don't get frustrated. It's because they're unwell and they may not be in a place where they can. When I've managed cases like this, what I've often done is build up trust and rapport with the client over a period of time. I've listened, I've taken their concerns seriously, though I've not validated the delusional belief. I've listened for quite a long time sometimes. I've done investigations where appropriate, but I've not done unnecessary investigations, and that's important for the animal welfare side of this as well. I've also stayed in touch with the client regularly via regular structured appointments so that we can support the client to maintain the welfare of their animal. And most importantly, I've encouraged the client to seek support and seek healthcare-based help where they can, and that would typically be through the person's GP. So way I might explain that would be to say, we're taking care of your dog and we're doing everything we can to make sure that he's healthy, and I'm happy to check out that he's healthy for you. Just really worried about how anxious you are about this and about the stress that it's causing you, and I wonder if you're able to talk to your own GP about that. So in summary, society expects us to help, our clients expect us to help, well-qualified veterinary surgeons expect us in our professional code to understand about mental incapacity and to be able to respond. It's a core aspect of our role as humans in society who are helping other people. We can always listen, we can always validate someone's distress and someone's stress in a situation. We can empathise and we can help. It's important that we don't presume incapacity and we respect individuals' views, needs and wishes. Thank you.